So what is this borderline business you mentioned on the phone?
Oh, look, I don't think that's useful to Susanna. I mean, not...
What borderline
You
business?
see, the mind
Borderline what?
is the
Borderline
only
between what and what? Melvin.
It's a condition, Susanna, and it's called borderline personality disorder.
Borderline personality disorder, or BPD, is a serious mental illness that is poorly understood by the public, medical professionals, and sufferers alike. This misunderstanding has made BPD one of the most stigmatized and discriminated against of all mental disorders. From the ambiguity of the name to the stubborn negative stereotype held by many mental health professionals, eliminating stigma seems daunting, but there is hope. What is borderline personality disorder? As of 2013, the DSM organizes the characteristics of BPD into the following categories. 1. Impairments in self-functioning. Often BPD sufferers will have poor self-image linked to excessive self-criticism. They may have feelings of emptiness and disconnection from reality, and they often have trouble gaining a sense of who they are. 2. Impairments in interpersonal functioning. People with BPD often have an intense fear of rejection and abandonment. They also tend to have an interpersonal hypersensitivity. Their close relationships tend to be intense and unstable, often switching between over-involvement and withdrawal behaviors. 3. Negative affectivity. BPD sufferers often have heightened emotional experiences and uncontrollable mood changes. They typically have intense interpersonal anxiety and fears about the future, especially with regard to losing control or abandonment by loved ones. They often deal with severe depressive states with intense feelings of hopelessness, worthlessness, shame, and self-loathing. Many sufferers will engage in self-injury and have frequent thoughts of suicide. 4. Disinhibition. BPD sufferers often act impulsively because of their intense reactions to immediate stimuli. They may have difficulty following plans, feel a sense of urgency in their self-harming behavior, and are more prone to risky, dangerous behavior related to strong impulses, lack of concern for their own safety, or suicidal ideation. Interconnected with these symptoms are comorbid disorders, meaning other psychiatric disorders that often coincide with BPD. Sufferers are more likely to be diagnosed with mood disorders, anxiety disorders, major depression, and PTSD. Additionally, they are at significantly higher risk of panic disorders, attention deficit disorder, eating disorders, and addiction. For the majority of sufferers, their BPD diagnosis incorporates the risks, stigma, and suffering associated with any of these disorders as well. On average, a person with BPD will attempt suicide 3 times over the course of their lifetime, and 10% of BPD sufferers will complete suicide. Borderline personality disorder can be very painful and challenging for sufferers, and tragically, many find these feelings unbearable. The suicide rates and health risks associated with BPD are staggering, especially considering the disorder occurs about as frequently as autism. The general insufficiency of action to help those with BPD is, at least in part, due to the negative stigma that surrounds the disorder. Mental health professionals are more likely to perceive people with BPD as having more control over their behavior than those with other disorders, such as major depression or schizophrenia. Sufferers are perceived as dangerous, manipulative, and difficult or frustrating to take care of, causing clinicians to be not only less empathetic but often negligent and abusive toward people with BPD. This is especially unacceptable considering sufferers may already be feeling worthless, out of control, or hopeless. The most effective known treatment for borderline personality disorder is dialectical behavioral therapy, or DBT, which combines components of cognitive behavioral therapy, Buddhist principles, and dialectical logic. Not only does DBT significantly reduce suffering, but is proven to reduce the number of suicide attempts in BPD patients by half. Additionally, it is an extremely useful treatment method for other disorders, such as addiction and eating disorders. For this therapy to become widely accessible and receive adequate funding, we must work together to change the way clinicians, sufferers, and the general public think about the disorder. Borderline personality disorder sufferers are often creative, compassionate, unique, and caring people. However, the loneliness and pain of dealing with BPD without help often makes it impossible for them to find their place in the world and reach their full potential. It is crucial to the lives of those suffering for accurate information about the disorder to be incorporated into clinical and public education. This may be the key to making changes in the system toward equal treatment and compassion for all people suffering from mental disorders. It is vital that those struggling with borderline personality disorder do not give up on themselves, even when it seems unbearable, and to never give up hope for the future.